Hello and namaste everyone. This is Karunya Richard, Support Executive at Institute of Inspiring Innovation. Welcome. Thank you for joining us on Inspiring Innovators, a show where we showcase innovative people, their innovations and the impact it's creating. Here we have our inspiring innovator, Arvind Thiagarajan, the founder and CEO of IIT Medical Inc. He is an inventor and entrepreneur with a history of founding, advising, and building technology companies. Arvind was mentored by Dr. APJ Abdul Kalam. Arvind was given a special award from Member of Parliament for Science and Technology from the Government of India for his contributions to research and science, and his work as part of HT Medical won Socially Relevant Product Award in IIT Madras. I would like to inform, if you have any questions during the talk show, request you to type them into the chat box. We'll bring them up in the end. Now, let me invite Naveen Lakur, Chief Innovation Coach at Institute of Inspiring Innovation, to the spotlight to host.
Thank you very much, Karunya, for your heartfelt introduction and the welcome. I'm so excited today because there is somebody here who is an inspiring innovator for the simple reason that, when I also did my engineering in electronics and communication, I learned in signal processing a topic or a subject when I was attending a session. My professor taught me that there is a little signal which goes when there has to be in communications and telecommunications. There's a little signal which goes initially, and it's called the handshake. And when at the both ends, when that connection happens, then it creates that channel for data flow to happen seamlessly. Right, and I learned that, and I was like, excited. But as I started working and building companies, nurturing ideas, and in the field of innovation, I realized people play such a big role. So as part of that handshake which needs to happen, that little signal, I realized that there is need for heart shake. Without that signal establishing between people, if there's no heart shake, there is no relationship. So if you want to build robust relationship, you need to cultivate the habit of having a heart shake. And here I have a person by name Arvind Thiagarajan, who's taken it to a new level. And he's saying, it's just not about the heart shake, and it is not about building robust relationships. It is about being that little extra, listening to that heart, and see how you can save lives as his inventions and the way he is modeled and made it as innovation is saving lives. Let's welcome Arvind Thiagarajan to the spotlight, and I have a few questions to ask. I can't wait. You have been an inventor, so serial inventor, just not an inventor, right? Like serial entrepreneur, you are a serial inventor. So excited to know. There are many, I'm sure. Which is your latest one?
Well, first of all, thank you so much for inviting me on this, and really looking forward to having this conversation. And you're doing some great work in inspiring the innovative journey amongst many youth and several others. So happy to be part of this. So yeah, I mean, there are so many inventions. The latest one, of course, is a product that we just announced at CES show here in the US called as Healthy U, which is actually the world's first intelligent all-in-one remote patient monitoring device that can monitor all 10 parameters that are important for assessing the patient's health. And this device literally fits within a pocket, and even a grandma at home can use it without any training. So that's how easy it is. And we hope and believe that this will truly revolutionize healthcare forever.
Oh, wow. That's revolutionizing healthcare forever. What I liked is even a grandma can use. Actually, grandmas are very, very, smart. And in fact, in India, there is ancient wisdom which is there. Grandma's treatment itself, they are doctors actually. So now you're enabling them with technology. That's interesting.
Sure.
So how do you actually say that it is even grandmas could use? Is there anything that you want to show or describe in a way that we understand that even grandmas can use?
I'll actually show you the device. This is how the device looks like. Obviously, it'll get more sleeker and fancier in future. So we have actually developed an earlier product, which is called HD Steth, which has integrated ECG leads on a stethoscope, which I'll also show you in a minute. But we have actually retained that same sensors on one side, but on the other side, we've added more ECG leads and optical sensors and so on. So what you need to do is just hold it with your 4 different fingers and put it on your chest. And that's it. Once you do that, within 10 seconds, it can capture all these parameters. I don't know if you can see on the screen: heart rate, pulse ox, respiration rate, temperature, and even the blood pressure, systolic, diastolic blood pressure. And it gives the heart sounds, lung sounds, and any murmurs on your software app. But most importantly, it gives a 7-lead ECG in real time, right? Simultaneously, it gives 7-lead ECG on your software. And that's a game changer, because today, most of the devices that are there, without any wires or cables on watch and so on, is just a single lead ECG. And this 7-lead ECG will be the highest in the industry. And that we hope will really help in remote cardiac monitoring. And a lot of issues with related to cardiac adverse events and things like that. So we can actually detect that at a home level. So that can truly save lives. So that's what we believe.
Wow. That's inspiring, definitely. And tell me, if this is a breakthrough innovation, especially when you're saying, without any wires and you are able to get the readings of 7-lead ECG, that's a lot, right? And it is fantastic, and it looks so cute, and you said it's going to become much sleeker. So is it going to fit into the chest itself then? It's a wearable device.
Our advice is saying don't make it too small, because old patients can tend to drop it or lose it and so on. And of course, our first generation device was designed for doctors, where we had developed the world's first intelligent stethoscope with integrated ECG leads. So these 3 dots are the ECG leads. So you don't have to connect any wires or gel and so on. So the device operates like a regular stethoscope, but much, much more. It gives the ECG, it gives the heart rate, and also it helps in detecting murmurs and so on. So that was our starting point. And then this new device is a breakthrough because, in the last 1 year, by the way, the earlier stethoscope was cleared by FDA in July 2020. And we were actually looking at the situation with the pandemic, and so many people were unable to go to the hospital or get their regular cardiac assessment done. And as a result, more and more people were dying. So that's where we wanted to really bring in this aspect of remote cardiac monitoring, remote patient monitoring, and make it available at the convenience of the patient's home, right? So without connecting any wires, patches, or cuff, or gel, or anything like that, just put this device on. It becomes your daily monitor, 10 seconds, just do a healthy you, and we hopefully believe you'll be a happy customer.
In fact, this raises a question for me. Is it, I definitely wanted to know what inspired you to create. Looks like, is it COVID which inspired you to create this, or is it anything much more than that? So let's hear that from you. What inspired to create this new device and your invention?
Sure. I mean, it's really about saving lives. So if you look at it, people really talk a lot about the COVID pandemic, but the true epidemic in the world is the cardiovascular diseases. Almost 18 million people die every year globally. And even in the US, almost 2,000 Americans die every day, right? And that's a very serious situation. And we believe one of the reasons for that is that, the art of auscultation, the listening to the stethoscope and so on, it needs to really be made into a science, right? So that there is a very objective, evidence-based diagnosis at the point of care. That's one of the challenges we are trying to overcome and improve the situation. But the other aspect is that, the more sophisticated technologies like ECGs and ultrasonic echocardiograms are not done routinely unless and until if the symptoms show up. But the classic problem is when the symptoms show up, the patient is not with the clinician. Whereas when the patient is with the clinician, the symptoms don't show up. And as a result, so many cases are getting missed out, and hence these number of deaths, right? So we tried to solve this problem in two parts. The first solution was the intelligent stethoscope for physicians and clinical professionals to use, and then the HealthyU device for the patients so that they can carry a device at home, because there's a saying, right? Even a best doctor in the world cannot take care of yourself unless if you don't take care of your own health, right? So we want to really deliver that level of health and technology at the patient's hand so that at the point of care, they can actually do a quick assessment of their own health, right? So we believe this can truly help in saving lives, early detection.
Wow. Just feel like listening to you, continue to listen to you, and I'm imagining how many lives are getting saved, and how the life would be a much better place, and this world a better place to live, right? Um, that actually gives rise to this question of what's your vision for this invention and the product that you have created.
Sure. We believe we want to touch more than 1 billion hearts with our products, right? Whether it is through our devices that we have designed for the physicians and clinicians who can then use it on the patients, or the devices directly for the home patients themselves, and even a lot of children. Now, as we speak, we are actually using this current HD STEP product to screen hundreds and thousands of children all over India, as well as several other parts of the world. And with that, we are actually detecting their congenital heart defects and other heart conditions at an early stage, and therefore referring them for follow-up care or a surgery. And that can truly save lives. So on one side, we're looking at children for congenital heart defect screening, and other side for adults, both from clinicians using it for better screening or triage, or the patients themselves becoming more responsible with their health.
1 billion hearts you want to touch. That's fantastic. That's a blessed soul. So you are a blessed soul, right? So where you have a fantastic heart, and where 1 billion hearts that you want to touch, it's just amazing. How do you want to take it to market? This particular new device that you have created, who is your customer, and how do you plan to take it to the whole world, right? Sure. Well, one of your product is already used in multiple places in the world, but this new one that you're talking about, a device which is at home, to be used at home, even by a granny. So Correct. It's a great combination of technology and granny's wisdom to save lives.
Yeah, sure. No, definitely we want to take it to the world through partners, distributors, other collaborators, right? And we as a technology company want to keep innovating and coming up with better and better solutions, and obviously working with the right partners in different geographies. We are in discussions with some of the largest names you can imagine, both in the healthcare industry as well as the wellness space. So this product can address to both those needs, right? So for telehealth as well as remote care and wellness, everything. So definitely through those partnerships, we want to take it globally. I mean, yes, initially our focus is US, but in parallel, we are also doing a lot of work in Asia. In India, as I said, we are doing a lot of the screening work. We're trying to collaborate with several government agencies, nonprofits, and others who are, inspired about saving lives. So we want to partner with those, players.
So this new device is definitely going to make a big difference in the way the healthcare, the service itself is happening. I'm also a member of Telemedicine Society of India.
Sure.
And where we are looking at, and with the pandemic, the government also approved many things has been allowed for remote care, remote management of monitoring, and then accordingly the care could be provided. And because contactless is become the new norm, and then you're looking at the data being available, which was a problem earlier, right? And third is that these technology devices, which are the IoTs, Internet of Things, and wearable devices. So if you're combining all of these and including for COVID kind of a situation or this during this pandemic, I see a big usage. See, even at our place, every day we have a practice of checking using the pulse oximeter and checking the saturation levels of oxygen. And but we are not capturing that data. It's a day to day. We are just checking, just to ensure. And can we, because prevention is better than cure.
Yeah.
So here, as much as this device seems to be all in one, and do you think it is useful even during this pandemic time, and how could this be used?
Yes. Well, we believe it can be very helpful during the pandemic times and also beyond the pandemic, because as you rightly mentioned, the contactless is the way to go. And this device also is a connected device through either our own platform. The device can start sending all the data, which will be backed by an AI-based predictive analytics framework, and that will assess the risk of the patient's health, particularly cardiac health, and so on. Right. So that is one option. The other option is, of course, you can connect this device to your computer or your phone or a tab, and then share your screen over a Zoom meeting or a Microsoft Teams meeting or anything like that. And with that, what happens is that the remote physician can have a live view of the patient's vital signs or cardiac parameters, and even the device has an audio output. You can actually send the audio through those platforms, and then on the other side, the doctor can use our stethoscope to listen to the sound, right? So then real-time auscultation becomes possible. Because today, unfortunately, most of these e-visits are happening just through video conferencing, like how you and me are talking, or sometimes even worse, if the elderly patients cannot even connect on video conferencing, it happens on phone. Now you tell me, how can you assess somebody's heart or other vital aspects just by talking through phone? Yes, you can ask, are you fine? Do you have any abnormalities? Do you have any symptoms and things like that? But beyond that, there's no evidence, right? There's no clinical evidence. So that's where this data is the key. And that's where our platform can truly enable. And not only during the pandemic, but even beyond this, well, the pandemic has really taught us how so many things can be done at home. So why can't we even have the health assessment at home? And then even if the patient walks into a clinic, imagine tomorrow a doctor is going to say, hey, take your healthy U from your pocket and then pair it with my kiosk, right? And then with a 10-meter safe distance of separation through our Bluetooth, it'll pair with his kiosk, and then he can get all the vitals and parameters. So that's where we truly believe this is going to change healthcare for good forever. Yeah.
Wonderful. Wonderful. I think this as a base can give rise to a lot of new innovations, like, innovation in process, innovation in terms of the service that is being provided, the patient care, healthcare. I think innovation, when we talk of, usually people refer to only medical devices or pharmaceutical. But there are many other things which, other 4 domains, which I call them as 6 different domains. One is in the policy, how a government policy could make a big impact and a change, right, in the way things are done, which you were mentioning about. And preventive healthcare innovation in that field is bigger than the reactive, which is currently the more focus on innovation is on reactive. And the other is the patient care, the where innovations could happen in patient care. That is big. So looks like this particular device, your invention, is touching and cutting across all these 6 domains of innovation in healthcare, according to me. So there's a big opportunity. At the same time, the impact that it can create is very, very large. So what stage currently is this particular new product, Healthy U, is at?
Sure. So on that, your earlier point, you're spot on. We are moving away from this concept of reactive illness to proactive wellness, right? And that's where, this device can really play a role in a daily monitoring of your health assessment aspects and so on. So the Healthy U device currently is ready for clinical partners and for other partners who want to evaluate this under the IRB exemption under FDA guidelines. So we are making it available in the next coming days and weeks. But we expect to have the Healthy U product cleared by FDA later this year, either Q3 or latest by Q4. And hopefully with that, we'll be able to sell it in the US market. But even before that, we have been getting tremendous amounts of inquiries from all over the world after our announcement at CES. And by the way, our product was rated by CNET as the most important health tech of CES 2021. So very happy about that. And so with that, we are expecting a lot of interest and partnership possibilities. As we speak, we are in discussions with quite a few of them. And we hope to bring it to the market, especially in countries like India and so on, where unfortunately, we are almost the leaders for cardiac diseases and so on, right? So we want to really bring this proactive aspects, to the home users. And also the current HD Steth device, which is already FDA cleared, has been in the market now for a few months. And it's already being very well received by healthcare professionals, both in the US as well as worldwide. So we're expecting to have this combination of products, one for the doctor and one for the patient. And hopefully that'll really help healthcare getting better and saving lives.
Yes, absolutely. It's so important for us to realize that the quote that you created, again, the beautiful invention of the quote, moving from illness to wellness, right? And how your device could help you, and you're actually empowering individuals. Earlier invention of yours was meant for professionals, the doctors and so on. So now you're enabling even individuals at home. It's your body. You need to take care of your body first. And body is talking to you. Are we listening? If you are not listening, here is my technology, which will help you to listen and also connect with the doctor who can guide you, right?
Correct. And you said it very well earlier. I mean, who would have thought of buying a pulse oximeter at home before the pandemic?
Yes.
Even having a thermometer was a rarity. I mean, BP and other things are just won't even really require people go for it.
Yes.
But now with the pandemic, there is increased awareness about taking care of one's own health and assessing their parameters and vitals and data driven, right? I mean, people measure their steps, how many steps they're walking, and they feel like they have really contributed to their health and well-being. So same way, using these parameters, we want to really help people watch their health.
Yes, very true. So this seems to be a nice extension. You've done a phenomenal leverage from your previous invention, which is the HD Steth. Talk to us a little more about the HD Steth and how you've been leveraging that into the new device, and how is it helping in the innovation from the business side of it?
Sure. See, the HD Steth itself is quite a revolutionary product because for the last 200 years, the stethoscope hasn't really evolved much. It used to be rubber tube stethoscopes, and there were a few electronic amplifiers, the so-called electronic stethoscopes. But what happened, just like how we started there, as good engineers, we always think the louder the sound, the better it is. But doctors don't like that, right? Because sometimes too loud it is, they find it too distracting because they are trained with the rubber tube stethoscopes. They want that faint, nice, and quiet sound. And when I talk about quiet, the ambient noise is a very big problem. And we have actually come up with specific innovations to remove this ambient noise and what we call as smart amplification, right? So, and intelligent noise cancellation. So with that, we are able to enable the doctors and even healthcare workers at the field level. I'll give you an example. We have these screening programs being done in India, where in the most remote villages, a basic healthcare worker with just a few minutes of training on this device can go and screen hundreds of children or patients on a daily basis, right? So we had spent a lot of time in making sure this product really meets the requirements of the doctors. And so from a business point of view, we are trying to leverage the HD Steth as the doctor's tool so that they actually I mean, some of them have access to the ultrasound echo, cardiograms, or ECGs, and so on, and many of them don't have that. And also, having an instant cardiac insight is very important, because before you go for a full-blown 12-lead ECG or an ultrasound echo or a treadmill and so on, should I refer this patient for all those tests or not? That instant cardiac insight, if you can give it on the spot at the point of care, that's the game changer, right? So that's where our dream and our vision is, that every doctor should switch to a digital intelligence stethoscope. Okay, just like how in the phone industry, I mean, almost 99% of the users today have smartphones, right? So same way we believe, and unfortunately that didn't happen in the stethoscope industry because only 15% of them were penetrated with electronic stethoscopes because of the reasons I mentioned earlier, noise and so many other factors. So we believe we have taken it to a different level. So this opens up a huge market opportunity, but more than anything else, it really solves a very fundamental need, because if you notice, the stethoscope is the first point of contact between the doctor and the patient, right? And the doctor's identity. And we learned some lessons from there. Like we had earlier products which had a box like form factor and so on, and some clinicians didn't want that because they want to carry the stethoscope and put it around their neck, and then they want it to really look like a stethoscope. That's very, very important, right? And they walk with so much pride when they have the stethoscope around their necks and so on. So we want to retain that aspect, in them. And of course, we want to ensure it's truly the best quality of sound. So we proudly boast that it's HD quality, pun intended, right? So it's HD quality sound that they can enjoy. And then more than anything else, they can visualize the waveforms on a screen. So we say they can see what they hear, and also they can see what they don't hear, because some of these subtle sounds are less than 30 or 40 hertz of frequency. And as you know, the human audio spectrum starts well above that, right? And as the physicians get older, these low frequencies are very hard for them to perceive. So that's where improving the sound, removing the noise helps, but visualizing it, seeing is believing. So visualizing it then and there, and then looking at the faintest aspects and measuring them. I mean, I used to talk to a lot of cardiologists. They used to tell me, if there is something called a hole in the heart, one of the defects is called atrial septal defect. And you need to measure if there is a wide fixed splitting of the second heart sound. And that is at 70 milliseconds interval. Okay, 70 milliseconds. Now imagine how on earth can you perceive a 70 milliseconds interval, and that requires years of training, in fact, decades of training, right? And some of the older doctors used to be so good at that. Just by listening to the sound, they'll say, wow, wide fixed splitting in the second heart sound. This patient has a ASD or atrial septal defect. But those skill sets are becoming a dying art today, right? And that's where technology can help, because we can even distinguish as low as 5 milliseconds, right? So, and modern platforms and computers and algorithms, AI can really help with that. So we can distinguish between a wide fixed splitting for a ASD defect at 70 milliseconds versus a opening snap, which is at 90 milliseconds for a mitral stenosis, versus a third heart sound, which is at 130 milliseconds for a heart failure. I mean, these are things that have become a lost art, and we are trying to revive those clinical skills with better technology. And this can really help younger generation students, medical students, to do better, right? And most importantly, from a screening point of view and so on, like we have had so many government healthcare workers we have trained within a day, they get as good or even slightly better in terms of the auscultation skills and so on with use of this technology, right? So that's the power of technology, how it can transform.
Absolutely. I think this is a fantastic example now of Inseparable Twins. Inseparable Twins is a book that I've authored. Like they are like two sides of the same coin. They're whole and complete by themselves, but when they come together, they unleash new power. This is human intelligence of the doctors and the healthcare workers, and the technology as the other side, that is artificial intelligence. So human intelligence and artificial intelligence as inseparable twins now. So you combine that using technology and amazing, and equipping both
Correct.
can perform much better. One is learning from the other, supporting each other, right? So bringing both happiness and prosperity. That's the whole theme of that book, Inseparable Twins. And your work is an example. So I'm so excited about that, to
Sure.
see happiness and prosperity.
In the medical world, they always say what really matters is what lies between these two things, right? Your brain. So, and we actually believe if we can give some of these tools and visualization aspects and better sounds and data, doctors can do really great, right? Our objective is not to replace the doctors. Our objective is to really empower the doctors with better technology. I mean, if a teenager can have the best technology for listening to music on an iPod and so on, why not the doctors? After all, it's a matter of life and death, right? They can really diagnose better. So we want to empower them with that. And our objective of AI also is to empower them to make better informed clinical decisions at the point of care, not to just send the data out and software telling, okay, patient is normal or normal. That becomes almost like a black box. We want to do a lot better than that. We want to give inputs and visualization and parameters so that they can make an objective evidence-based decision, clinical decision.
In fact, the other point that I was observing when you were sharing, see, there is a big difference between the invention and that being put into use, into commercialization or bringing benefit. There are many people who could invent, okay, and very few have figured that out on how to commercialize it, how to bring it to market, how the adoption. See, that is where the innovation plays a big role, right? That is innovation. So you have done it very well. And the design of the stethoscope itself, like using stethoscope as a method to touch the heart rather than creating a new device. So what was that process? How did you go about? Because it was non-threatening to the doctors, and in fact, it was their pride and identity. So you maintained that and enable them, empower them to do their job better. So there is a science behind it. I'm sure you've thought a lot about it and the way it is. And how did you go about this whole journey? So talk to us about that journey of innovation.
Sure, definitely. I mean, we always say in the medical world, from benchtop to bedside as a device, it takes a long journey, right? And you have to do this the right way, and the only way you can do it right is by making a lot of wrong things. You can learn out of mistakes and experience and so on. So it has been a journey for us also. And so my journey actually started much earlier. When I was 13 years old, I was detected with a congenital heart defect. I almost passed out during a physical training session in school. I was rushed to a hospital, and I was detected with a heart defect. And until I was 21 years old, I had to go through annual ritual of echocardiograms and so on to determine whether I needed a surgery or not. Thankfully, I didn't need a surgery. And looking at the stress and anxiety my parents went through, I actually determined to become a doctor in life. And despite scoring 99% in my core subjects, due to various other reasons, reluctantly ended up in an engineering college, even though a very prestigious one in Guindy Engineering College. I was obviously a little disappointed, couldn't become a doctor. But thankfully, those were the years when I met my mentor, who's none other than our former president, Dr. Abdul Kalamji. And so I was really inspired by his words of wisdom and so on. And he inspired me to believe that if you're a doctor, you can help thousands of patients. But if you're a doctor's doctor solving their problems with technology, you can not only help thousands of doctors, but through them reach millions of patients, right? So with such inspiration, started working in this field of coming up with better technology. The original idea was much different. The original idea was just to create a bunch of algorithms on a laptop and then let people connect to it, and then it can give you some diagnosis. But then it took a while when we started doing some clinical studies. I was fortunate with Dr. Kalam's guidance, filed some patents for this technology and so on. And I was initially funded by the Singapore Government Innovation and Incubation Fund. So they gave me $1 million right out of college. That's how I started my career. And while doing some clinical studies in Singapore and other places, we realized the need for making this into an actual device rather than just a software, because those are the dot-com days. And we even tried to name it originally myheartbeat.net. Okay, so that was the original name. But then it took a lot of interactions with some of the leading cardiologists and doctors on how, it's very tedious for them while they are in their clinical workflow to come and connect and do a software and all that kind of stuff that may not work. Whereas if it's a device, self-contained device and packaged really well, that's where we thought about it. And then they need to hear the sound better and they need to visualize it and so on. So we came up with the device idea. And of course, the first idea was a visual stethoscope where we integrated a visual display on the stethoscope, almost imagine like a phone attached to your stethoscope. But then it became a little bulky, and then doctors were all having smartphones by then. So then we thought of changing that form factor to the HD Steth, where the display and all the intelligence happens on the phone or the tab, and then they can have a stethoscope-like looking device, and it becomes lighter, smaller, and all that kind of stuff. So it took a bit of a journey and a lot of learnings. But as a technology, it really evolved with more and more interactions from clinicians, and they're really, really good. They know exactly what they want. They'll tell you, can you do this? Can you do that? Can you do that? And as a technology, you got to assess, what is feasible and what is immediate priority, what is the future rollout. So we have like a few hundreds of different ideas in terms of product variations and so on. But it's also about getting it out in the market and of course patenting it and then getting the right partnerships going. Commercialization, it's still a journey. We wouldn't claim that we have captured the markets completely yet, but it's a journey, and we have to do it the right way. And we want to get the clinical pull from the market. That's very important, right? Rather than we trying to push with more and more ads and things like that. We want to really get the clinical pull, and that's to really solve a problem. If we can make our customer happy, whether it's the doctor using it or a home device, a patient using it, if it can really solve a problem, if it can really save lives, that's what really matters for us.
Fantastic journey. And every invention, it becomes more meaningful if there is that personal touch and the story which has inspired them. I was wondering, what would have been that trigger, and now I understand. It's your own heart, and
Right.
which is an inspiration for you to be inventing such a way that it is touching many many millions of hearts, and with a target of 1 billion to be touched. So that's the vision of yours. So it's very inspiring. We wish you very very good luck and blessings of the Lord for
Thank you.
making this happen, because it's a great thing to shift from illness to wellness, and this device reaching homes and people, empowering, enabling people is an interesting approach, right? So with that journey of yours into this innovation, how do you plan to make heart as a heart wherever it is, and how do you ensure that it reaches more people and the impact is much larger and reaches that billion? Any thoughts on that?
Absolutely. I mean, we always believe healthcare is not about teaching or preaching, it's about reaching people. And reaching means different things, right? One is it becomes available, accessible, and more importantly, affordable, right? So we want to first of all make sure this product is available and accessible, and because in a lot of countries, technologies like ultrasound echocardiogram or even for that matter 12-lead ECG, it's not accessible, and even if it is available, there aren't enough specialists to acquire data sets or images or interpret them and so on. That's where a simple technology like this, which even a basic healthcare worker can use as a HD Steth, we want to make that available and accessible. And also we want to make it extremely affordable, right? We don't want to price it in thousands of dollars, right? Like a basic electronic stethoscope today costs about $500. So we want to price it around that same benchmark so that it actually is more affordable for people to buy. And likewise, the Healthy You kind of device, right? People often ask us what is the pricing and so on. And we are trying to evolve again a very affordable model where if somebody is paying on a monthly basis for Netflix subscription, right? Why can't they do something similar for their health subscription, right? So So we are coming up with some very innovative models where we really want to give the opportunity for a home user or a patient to take control of their health, right? So that is where we are going with this. And of course, it's all about partnerships and the right channels and distributors and so on. So we have been fortunate to actually be working with some leading players, both in US as well as in Asia and other parts of the world. So we are continuing to expand those partnerships and possibilities. So definitely in the next coming weeks and months, you will see more of our products in multiple geographies.
Oh, fantastic. Best wishes for that. It's a wonderful case again for invention being utilizing all the other aspects of innovation, business model innovation. You're talking about that, and there is a need for it in how it could save lives, right? It's the journey does not end with an invention, but if you could bring in all the other aspects and the other domains of innovation, it can make a huge difference. And this can cut across multiple domains of innovation. And you are a person who I think always been thinking about how to be that little extra and how you could create an impact, right? Reminds me of a story which I think you put it into use. And this is a story that I heard once in Puttaparthi, where my spiritual guru, Sri Sathya Sai Baba, was sharing. It was a special occasion where some of the members of the organization had to go and do social service. And they were on their, getting to start to go to a tribal place, literally into a forest, and do social service there. So they wanted to seek blessings. They came to Swami and said, "We're all set, and we are just about to start. Thought we will get your blessings," and we start. Swami blessed and said, "Very good, but be careful." And they said, they were wondering, and Swami said, "There are a lot of snakes there, right?" And then immediately they said, "No worries, Swami, we have got the gum boots, the big ones and tough ones, and we're all covered, so there's no problem, we are all safe." So Swami smiled and said, "Just not about you, I'm also referring to the snakes." So so it was see, that is divine, right? It's just not about human beings. So he is divine, so he could see the other beings of the snakes or the animals. They're all beings, and we as human beings only think maybe restricted to our domain and our area, but we need to go beyond that. We are all co-living. We are just one actor in this whole play. And when Sathya Sai Baba could see that compassion, that caring, that love for all beings. So to me, you are also divine, because I don't know, you've taken that message to your heart and you use this HD stat to go to the next level of other beings, other than even human beings. I think you've extended this very well to even to the veterinary side of it. Talk to us about how you extended, what was the inspiration behind that, and how has it been used?
Sure. I mean, it was an interesting experience because we were working towards our FDA clearance for our HD stat device in the US market. But then we were approached by some veterinary partners and distributors saying that, the veterinary space doesn't require FDA clearance. So you can actually take the product ahead of time. So we started doing that, and then we realized, my God, what a great need that is, right? In some sense, people are more particular and passionate about their pets, than their own children sometimes, right? So, and we found so much specialization in this field, and we actually ended up customizing our product. We have a product line called StethVet, HD StethVet, and where for hairy animals, they can actually extend this and then connect it for getting their ECG and things like that. Things are done. So that actually was very well adopted, and we're very happy about that. So that's where we say we actually address to multiple P's. One is, of course, the patients, the physicians, the payers, providers, professionals for teaching, and so on, and even pets. So all P's. And our philosophy is, as a company, it's not only about profits, but we want to build great people with a lot of wonderful performance, and above all, the purpose, the real purpose of saving lives, whether it is pets or patients, humans, or anybody, right? Or enabling physicians and professionals and so on. So we want to really be a purpose-driven company, and of course, with great people and performance and profits that comes naturally. But this purpose is really key, and that saving lives. As technologists, we want to really build such socially responsible technology, and that really gives a lot of purpose and meaning in our lives. And I mean, when we hear these stories of patients, children getting screened. Last week, we signed an MOU with the state government of Chhattisgarh, where we have actually now taken this device from India's Republic Day on 26th of January to a very remote tribal village called Bastar in Chhattisgarh. So that's like a few hours away from a main city like Raipur. And these tribal areas don't get any care at all. So that is truly taking this technology and reaching to places where it really is needed the most. So that's what we are so happy about. And I always tell people, success is what others define you with, whereas satisfaction is what you know for yourself. So if you ask, are you a satisfied entrepreneur? I can say absolutely, right? And a successful entrepreneur or not, the market will decide, and of course, future will tell. But really, this purpose is what drives us, every day.
Absolutely, I think that itself is very inspiring, and the journey of yours and how it is reaching so many people with all the piece that you narrated. If those are all there and led by the purpose in the front, definitely another P, which is the popularity, will follow. So that will be taken care of, right? So that is for it to follow you, while the purpose is leading in the front. So it's very inspiring. So tell us how many arts it has already touched. You're saying there is government adoption, and then policies have been changed, and at the same time, the doctors, the caretakers, they're all started to utilize, especially with your HD Steth. How many hearts has it touched already?
So our target actually was 500,000 children last year, but because of the pandemic, some aspects of that were a little delayed. But I'm pleased to say we have already crossed more than almost 100,000 children have been screened and patients have been screened, and we've just commenced the screening of 77,000 children in this Bastar remote location in Chhattisgarh. And then last year, despite the pandemic, on October 2nd, on Mahatma Gandhiji's birthday, there was a program started near Bangalore in a district called Chikkabalapur, where we have, again, some very high incidence of congenital heart defects because of the malnutrition of expectant mothers. So there was a huge program that was commenced for screening over 100,000 children. So with all that put together, we actually believe in the next coming months, within a year or so, we would reach the target of more than 500,000 hearts being touched. And also, as we speak, some of the leading states in terms of healthcare in the country in India have adopted this device for even screening neonatals or newborns, because the current state of art is to check them with pulse oximetry, and that has proven to be only less than 50% accurate. Whereas by adding some additional parameters using our device, they were able to extend this accuracy to more than 90%. So if that gets published and proven, then we believe every birth center could actually have this device and so on. And again, that can really make a big difference at the birth itself to determine whether a child has a congenital heart defect or not. So that's the starting point. But now with HealthyU, as I said before, we really want to make this available for as many patients as possible. And that's where we truly believe we can realize this dream of 1 billion hearts, touching 1 billion hearts. Yeah.
How do you think they will coexist? These are interesting devices for two different markets and the user.
Sure.
So how do you think they coexist and complement each other?
No, absolutely, that's a great question. We believe these are two pieces of the bigger puzzle that we're trying to put together and solve, which is the cardiac problem. And on one side, we want to enable and empower the doctors with the HD stet device that they can hear the sounds better. On the other side, we have the patients sending the data from their home level, and then the doctors through our cloud platform, which will have the AI aspects, and it will do some preliminary screening and so on, and then send it to the doctors, and then the doctors can use this device to actually listen to the sounds. We also have some very innovative accessories, product accessories that comes part of the package. We have something called HD Stet Pod. So you can connect the Stet Pod to your computer or a laptop or a phone or a tab, and then you can place the HD Stet on it. Or we also have Stet phones, HD Stet phones. So you can, it's almost like an audio jack, but you can connect it and then listen to it as if like a stethoscope, right? And then we have a solution called Guru Doc, HD Guru Doc for teaching, where 10 students can simultaneously listen either on a bedside or in a classroom. So like this, we have a lot of these accessories and innovations for solving multiple problems. So one is the telehealth use case for doctors, so that can coexist with the Healthy like product from the home, and then teaching, screening, so many different opportunities. But of course, we want to stay focused one at a time, but we are doing a lot of these innovations as we speak. And again, India is a great opportunity for us to try out some of these innovations, get real-time market feedback. The kind of data sets we get, it's like huge. And I mean, for doing 1,000 patient study in the US, it could take more than 6 months. In India, we can do it in a week's time, right? So that's the power of the population and the data that we can get. So we're really looking at expanding those clinical studies post the pandemic, and both in India as well as overseas in the US especially. So we're collaborating with some of the leading institutions like UCSF, Cleveland Clinic, Stanford's of the world, and so on. So yeah, very excited about that.
Wow, seems to be an exciting journey, especially with the purpose in the front to save 1 billion lives. Is a fantastic, inspiration for your own self and for others who are listening to this and who are aspiring innovators. So your story is definitely an inspiration, and the journey that you've had. How many patents would you have applied for, which is in the process of grant or already granted? How many would it be?
Well, to be honest, I've lost count of how many patents, but a lot of patents. I mean, most of them we pursue, some of them we file, and then later we choose to not pursue, and so on. So yeah, I mean, in terms of actual applications, it would have crossed more than 100, but in terms of things that we pursue, I believe the last count was more than 50 or something like that.
Wow.
But yeah, so we are trying to improve on that, increase the number of patents, but I think that's a journey.
Fantastic. And the journey is the reward, they say, right? So you should definitely continue to enjoy the journey. I'm inspired about the story that you shared on how, what was the inspiration for you? And as an engineer, how you are able to enable and empower the doctors to provide healthcare much better. And while they maintain that identity and their pride as a stethoscope as the means, and actually there is one important factor that I could recognize when you were sharing that. Usually invention, when it goes through the process and commercialization or adoption, which is very critical, right? And people do resist change. While we know that change is constant, they resist change. And I felt it was a fantastic strategy that you had adapted, where using stethoscope as the way which they're already used to, but the information which they needed through the data that they could capture wasn't as effective, right? And you're now making it more effective. So it was very strategic, according to me, the thought process, the design of the product, and it's all data driven based on the user feedback and observation and with the objective for adoption, at the same time, the bigger purpose being there to save lives. So
Sure.
just fantastic. I think I can continue to keep asking, and I'm sure there is loads of that wisdom through these experience that you gained. There is so much more to share. There are sure a few questions which would have already come from our audience. So I would like to turn it around to Karunya to see if there are any questions, and then how do we to stay inspired, right? And this is a phenomenal shot of inspiration touching so many hearts, definitely touched mine. Let's move to Karunya. Over to you, Karunya.
Sure. Thank you.
Thank you, Naveen. Yes, we have received a few questions I would like to read out. The first question which we have received is, you have been mentored by the one and only Dr. APJ Abdul Kalam. He was a scientist himself and the former president of India. What are the 3 things you learned from him that which you're willing to share with us?
Sure. So, I mean, first of all, I owe everything to Dr. Kalam for where I am today. If not for his early inspiration on pursuing this innovation journey, my life would have been totally different. But of course, we all know this famous quote from him, right? The dream is not something that is something you get in your sleep, but the dream is something that will not let you sleep, right? And he always says, "Dream big," right? And that's what in a small way I dreamt big with his inspiration. I mean, as a student just coming out of college, and to be perfectly honest, I was trying to apply for my master's in various leading institutes in the US. I was trying to secure funding for that and all of that. And then I even had a job offer from my university, but unfortunately, that was the year of 9/11. My job offer was delayed by 6 months. And that's when I was almost getting a little, concerned about what am I going to do. And that's when Dr. Kalam said, listen, you go file a patent and then dream big to go found your own company. And, and then the rest was history, because the Singapore government's criterion for funding at that time was IP-based innovation. And unfortunately, most of the companies they found in India were IT-based companies, not IP-based companies. Many of them had patents. So thanks to Dr. Kalam's advice, with this patent, it helped me in securing almost $1 million of funding to get started on this journey. So dream big, that was the first lesson. And then, of course, as the saying goes, only 2 days that are very happy days in an entrepreneur's life is the day when you start your company and then the day when you sell your company. The rest is all challenges, right? The problems get bigger and bigger when you go through this journey and so on, and you just have to persist, right? And sometimes you fail miserably, and Dr. Kalam always used to say, failure is first attempt in learning, right? And then if its answer is no, it's a next opportunity. So you got to keep persisting. Winners never quit, quitters never win. That's the kind of the second story that I really learned from him. And I did lose some touch with him during his presidency term, but later, of course, got back with him in 2008 onwards, and again met him several times in 2010, and as late as 2015, January, and so on. So a lot of interactions with him. And also the other aspect, I was also involved in some nonprofit foundations that I was part of creating and also being involved with. And he used to always say, it's not about having great intentions and passion. You need to really have action, right? I mean, good intentions are good, but real action is what makes things happen. So, and then I was for a long time reluctant to move out of India. And then when it finally came to a stage where I had to go settle down in Silicon Valley to really take innovations and our companies to the next level. So I went to him and asked him reluctantly, should I do that? And his advice was, it is okay to be an NRI, a non-resident Indian, but it's not okay to be a not responsible Indian. So you can live wherever you want, but as long as your intention is to serve your country or serve people and the right purpose in your life, go do it, right? Kind of a thing. So these are all some lessons. Of course, a lot of other experiences, some amazing, amazing stories with him. What was supposed to be a 5-minute meeting, showing him the earlier version of the HT stud device, ended up becoming a 45-minute meeting where he himself was going and checking the hearts of every one of his colleagues and so on, like a child. And then he was giving us all these inputs. I mean, the kind of inputs that he gave us in that one meeting, it took us almost 10 years to actually start implementing and so on. And still we are continuing to do so. And some of the leading cardiologists agree with some of the suggestions that, in fact, adding the ECG was Dr. Kalam's idea. So we owe it to him, right? Having it on telemedicine through connectivity to phone was his idea, right? So we owe it to him. So, I mean, some amazing, amazing experiences from him. So completely owe everything to him as my mentor and my guru.
Thank you so much for addressing this question. Dr. Kalam is a role model and he's an inspiration. Listening to his name, we get goosebumps. And you've been mentored by Dr. Kalam is such an honor. Thank you. Thank you for sharing the experience with us.
I had a phenomenal feeling when you were sharing this, right? Because I've quoted Dr. Abdul Kalam, the dream thing that you mentioned, something which gets you no sleep, right? That is the kind. So I've quoted that. But last year, it was he's been an inspiration to many, including me, just the way it is for you. But you've had the opportunity of being mentored directly. And for me, he's been an inspiration. So last year, I got one WhatsApp message with a photo by Sabir Chabra, head of operations of T-Hub, a large incubation center in India. And he said, hey, look, Naveen, what I found in Dr. Abdul Kalam's museum in Delhi. So I was like surprised and checking, and there was a stack of books. And he says, I saw Inseparable Twins book in his personal collection. Wow. So I was super excited, and it's an honor because he's my inspiration. And here he's got my book as part of his personal collection. Is blessings, wow. Right? So now when you're talking about what all you learned and so on, so I feel wow, so blessed. And I was supposed to go see that in Delhi in his museum, and this pandemic stopped all the travel, and hopefully in the coming days.
Wow, amazing! That's great. Nice.
So Karunya, any other question?
Yeah, there's one more question, which is. Invention in healthcare may be exciting, but the process involved in bringing it to the market is very challenging. Where do you draw inspiration to deal with the challenges?
Sure. I mean, definitely nothing comes easy in life, and especially when you're trying to prevent so many deaths and make a fundamental change in how healthcare is practiced or delivered, it does come with a lot of challenges, and you have to persist. And what really keeps us going is really the passion and purpose for really saving lives and making a difference. That's what keeps us going. But apart from that, at a practical level, coming up with an idea is one thing, implementing it as a product is another thing, and then taking it through the testing, clinical evaluations, and regulatory hurdles, of course, patenting, funding, right, marketing. So many different aspects have to come together, and it's all about building the right teams and getting the right advice and working with the right people. Like we learn a lot whenever we talk to our end customers. Like when we talk to doctors, they will really tell you what will work, what will not work. But as technologists, sometimes we can get too enthusiastic about coming up with a lot of technological solutions that is trying to find a problem to solve. Whereas it should be the other way around. Find the problem and then the solution should evolve, right? So it's like you don't want to put the cart before the horse. So big part about it is really finding the right problem and how big is the problem and trying to find the solution and the product market fit. Once that is established, the rest will most likely follow. Of course, funding included and all the other aspects included, regulatory. So it's all about getting the right team and advisors and things like that. that really helps. You want to have good people around you when you want to build a solid company. Yeah.
Thank you so much.
Great.
Thank you for being on Inspiring Innovators. We are grateful to have you, and it's truly inspiring knowing about your inventions and your experiences. And it's
Thank you.
I'm
so
sure
much.
these devices will make our world a better place. Thank you so much.
Yep.
And
Thank you. Thank you.
they're too good. Thank you.
Thank you. Thank you again.
Thank you so much. It was a pleasure having you on this show, Inspiring Innovators. And you are an inspiration to many young people and all over the world. And an example on how a purpose-driven invention and innovations can create a big impact. So thank you, and let God bless you with a lot more courage, strength, and capacity to innovate and make a difference to this world.
Thank you so much. And I'll just mention this in my very last meeting with Dr. Kalam in 2015. I was waiting for almost more than an hour, and usually doesn't happen. And then he came and later apologized, saying, I had these 100 children waiting for me, and I had to meet them first. And then I came to meet you and so on. And I said, sure, sir. I mean, of course, we'll wait even for 10 hours to meet with Dr. Kalam. But at that time, he was mentioning how it is so important to inspire the younger generation, right? And innovation need not start after you graduate from your masters and things like that. It can start at the grassroots level, at the school level, right? So one of the reasons I would love to do this is to inspire other younger inventors and entrepreneurs, just like how Dr. Kalam did this for me. If even one person watching this can become an entrepreneur or inventor and pursue this journey and dream and look at contributing towards saving lives or to serving the society, to me, that is what I'm really hoping and praying for from this. And I really thank you, Naveen, for doing this, and your innovation, this institute for doing this. This is really what India needs and the world needs. So my best wishes to you all too, and thank you so much for organizing this.
Thank you so much.
Thank you.